Hello and welcome to everyone. We're so glad you've joined us for today's webinar session. We have some great information to share with you, led by our amazing health insurance specialists, all with the goal of helping you to better understand Medicare. My name is Patrick Padalecki. I'm a product management director on the health solutions team here at USAA. I'm a licensed insurance agent, and I've been with USAA for 37 years now. And whether you're approaching Medicare eligibility, already on your Medicare journey, or maybe you're caring for a Medicare eligible parent or family member, we all know health insurance can be a complex topic. And really, Medicare is no different. Individuals researching Medicare often leave with more questions than answers. And really, that's why we've developed this webinar. We want to help provide some foundational Medicare information and break down some of the basics. So today, we're going to be discussing Medicare Parts A, B, C, and D. We'll help you understand what a Medicare supplement is or a Medigap plan, and discuss when a Medicare Advantage or a Medicare supplement plan makes sense for an individual. We're also going to cover Medicare enrollment periods and when you should start your enrollment process. We're going to cover information relevant to veterans to help understand your Medicare options when it comes to TRICARE for Life, VA benefits, and CHAMP VA. And before we dive into today's information, I'd like to take the moment to go over just a few housekeeping items. So when you registered for the webinar, you selected if you'd like a callback from one of our licensed insurance agents. If you'd like to bypass waiting for a call, you are more than welcome to call us directly at 888-215-8702. Or you can visit usaa.com/Medicare to schedule an appointment online. Okay, I'd like to mention just a few things on your Zoom window that will be important for today's conversation. So you'll notice a button in the bottom section of your Zoom webinar screen that says Q&A. Should you have any questions throughout the webinar, please submit them by clicking the button and typing your question in the box. We'll cover a few of the popular questions towards the end of the webinar. However, we have a number of USAA team members who can respond directly to questions using the Q&A box. And if you submit a question, only our team and I can see the question, and it will not be visible to the rest of the attendees. So we do this as everyone's health situation is different, and we want to be sensitive to that and ensure that the information isn't seen beyond the USAA team. And throughout the webinar, we'll be running several polls. And these will appear automatically on your screen, and you can interact with them to cast your vote. Next, you should see a button labeled Resources at the bottom of your Zoom window. And if you click that button, you'll find links to a few Medicare-related articles that you might find interesting. And in that same section, you can find today's slides for download and to view the bios of the speakers today. And lastly, our webinar is recorded, and you should expect to receive an email with a link to the video in case you'd like to share it with your family or your friends, or just to refer to it later. So let's introduce today's speakers. So joining me for the webinar are two of our senior level health solutions specialists. And we have with us Cicely Patridge, or Cece as her colleagues know her. Cece is a manager and a licensed insurance agent on the health solutions team here at USAA. Over her 19 years with USAA, Cece has held various positions before entering her current leadership role. And today, she leads a dedicated team focused on providing exceptional Medicare guidance and support to our members, a task that she finds very rewarding. And next up, I'd like to introduce Corey Edmondson. Corey is a licensed insurance sales agent and is also a senior level health solutions specialist. And he's been serving our Medicare community for more than 30 years. And he has financial services experience and has proudly served at USAA for the last 15 years. Thank you both, CC and Corey, for being here with me today and sharing your expertise with our webinar attendees. And to give you a little peek behind the scenes here at USAA, because our mission is centered around serving military members and their families, we start just about every meeting with USAA's mission. For us, it's critical to immerse ourselves in the mission and to keep it centered to everything we do. Our mission is to empower our members to achieve financial security through highly competitive products, exceptional service, and trusted advice. And to bring this mission to life, we share what we call the mission moment during our meetings. So, Corey, can you help us out with the mission moment? I understand that you have a story that you'd like to share with us today.
Yes, I do, Patrick, and thank you for having me today. Recently, I received a phone call from a veteran who's been using the VA for his primary health care for many years. He'll be turning 65 soon and wanted to know if he really needs to use the VA. He had a buddy that tells him, "You've got the VA, don't worry about it, you don't need it." In my discovery with the member, I find out that he has an upcoming dental procedure need, and he also travels throughout the United States in his RV. Being he isn't 100% disabled, the VA will not provide him dental coverage. We also discussed with the VA, it's an excellent source for healthcare for him, but it's not insurance and cannot be expected to cover all out-of-pocket costs outside of the VA, such as using the civilian hospital or urgent care. And because he travels, he could find himself in an area that doesn't have a VA facility nearby. By signing up for Original Medicare, he could look into a Medicare Advantage plan that could potentially provide additional health and wellness benefits, depending on what the benefits are in his area. And since he travels, I explained the importance of understanding coverage restrictions with out-of-network providers as he's on the road. The member was very happy to hear this on these options and is now working with Social Security to get his Original Medicare, and we'll get him a plan that hopefully to meet his needs.
Thank you, Corey. So this is a great example of how you and the rest of our health team work so hard to do what's best for our members by providing guidance when they need it the most. So thank you for being there for all of our members. You know, it's an excellent reminder of how USAA has served individuals with their Medicare choices for more than 30 years. Medicare products offered through USAA are not only available to current members, but similar to other USAA life insurance company products and services, they are open to the general public. So let's kick things off by starting with our first poll question of the day. Okay, so it should be displaying on your screen in just a moment. And so here is the question. How familiar are you with Medicare Parts A, B, C, and D? And we've provided several options to choose from that you can see on your screen. And we'll leave this up for a moment so you can make your selection. But we're going to go ahead and continue with today's webinar content. So let's level set and start with some of the basics and build from there. So first of all, what is Medicare? Corey, so let me toss this question over to you to start us off, please.
All right, I'll be happy to take this on, and here we go. And let's talk Medicare. When you peel back the layers of this onion, Medicare boils down to being a health insurance plan that's provided by the federal government and it's managed by an entity known as CMS for short, but Centers for Medicare and Medicaid Services, as we know it as well. Generally, Medicare is available to anyone who is eligible, typically by the age 65 or older, of course, and for individuals that have a disability. Medicare is divided into 4 parts, as you alluded. We got the ABCs and D. Parts A and B are also referred to as Original Medicare, and you'll hear us mention Original Medicare throughout this entire webinar. And when we're referring to Original Medicare, that's going to be Parts A, Hospital, and Part B, Medical. Parts A and B cover a wide range of health services, but they don't cover everything.
Thank you, Corey. I appreciate that. So with this background and context, let's break down the 4 parts of Medicare for our webinar attendees. So let's start with parts A and B. All right, Cece, can you tell us what we need to know about Original Medicare, please?
Of course, I sure can. Let's start with Medicare Part A. This is often referred to as hospital insurance. Part A covers inpatient hospital stays, skilled nursing care, hospice care, and some home health care. However, it's important to know Part A does not cover long-term care, like nursing homes or assisted living facilities. That's separate. We know a lot of people find themselves in situations where they require more permanent care and expect Medicare to cover the cost of nursing homes or assisted living facilities, but that's not the case. You qualify for Part A if you worked at least 10 years and paid Medicare taxes, typically automatically deducted from your paycheck. You usually won't have to pay a premium for Part A. You're automatically enrolled in Part A if you already are receiving Social Security benefits. If you haven't started Social Security, you will need to enroll in Medicare Part A on your own. This can be done through the Social Security Administration office or by visiting ssa.gov. For most people, Medicare Part A has been paid into by having it taken out of your employment paychecks. Therefore, you generally don't have to pay a monthly premium. You are still responsible for deductibles and copays should you need to be admitted to the hospital or a skilled nursing facility. As a quick refresher, the term copay means that you, the individual who's covered under health insurance, is responsible for paying a portion of services as a dollar amount. In Medicare, coinsurance is referred to as a percentage of the total cost of a covered service that you pay. For example, as a hypothetical, if your plan is an 80-20 plan, that would mean the insurer is responsible for 80%, while you, the patient, is responsible for 20% of a covered service. Now, let's move on to Part B. This covers specifically outpatient care. So this is your doctor visits, rehab therapy, and some preventative services. For example, it covers doctor services in and out of a hospital, and most medications required to be administered in a doctor's office. And of course, your durable medical equipment. Now, you're eligible for Part B automatically once you become eligible for Part A, but Part B is voluntary. Most people with Part A also enroll in Part B to make sure their basic health needs are covered. That way, you're covered in the event you need to go to the hospital or a skilled nursing facility. And you're covered for medically necessary and preventative services. When we talk about Part B, also known as medical insurance, some examples of your coverage would include like Medicare-approved preventative services, your lab work, radiology, doctor visits, and outpatient procedures. Now, unlike Part A, there are costs associated when enrolling in Part B. So let's touch on that for a moment. The standard monthly premium for Part B in 2026 is $202.90 each month. This amount can change year to year as it's set by CMS. And this premium can increase based on your income. It's based on the IRS tax return for 2 years prior to your enrollment into Medicare. So if you're a high income, you will pay more. If you think you might fall into that bracket, you can go to medicare.gov to learn more. We've seen questions from members that ask, what if your income changed from the last calculation when I enrolled in Part B? In that situation, Medicare does indicate they will review those situations case by case, and they recommend contacting Medicare directly to discuss. Again, that's controlled by CMS, and you'll need to reach out to them directly for more information about the process. It is important to sign up for Part B when you become eligible for Medicare, unless you're still working and you already have group health insurance from your employer. There are enrollment penalties to consider, but we can talk about those a little further in our webinar when we talk about enrollment timelines. Now, for a quick recap, Medicare Part A is the hospital insurance component for Medicare. And for most individuals who've worked where you receive a paycheck with tax deductions, Part A has no monthly cost because you've paid into it all the years you've worked and are entitled to receive the benefits. Part B is your inpatient care to help cover your doctor visits. Part B does come with a monthly premium based on your income from your previous 2 years' tax returns. You can delay Part B if you're still working. Patrick?
Thank you, Cece, for all of that. That's a lot of good information there, but essentially to recap, Part A covers hospital care, Part B covers medical necessary and preventative services. And together, Parts A and B, Original Medicare, are at the core of an individual's health care for those eligible for Medicare. So, Cece, while you were talking about Part B, I heard you mention Medicare Advantage. So that's a great segue into addressing Medicare Part C, which is also known as Medicare Advantage. So can you give us an overview of Part C, please?
Of course, Patrick. Now, Medicare Part C is also known as Medicare Advantage. These plans replace Original Medicare with a private health insurer offering options like HMOs and PPOs. You must keep Medicare Parts A and B and continue to pay the Part B premium. In general, depending on where you live, most Medicare Advantage plans include Part D. That's your prescription drug coverage. They often include additional health and wellness benefits that may be important to your overall healthcare needs. Medicare Advantage plans generally have lower monthly premiums, and you may want to stay within a network of providers to avoid paying more out-of-pocket expenses, and they also have deductibles, copays, and or coinsurance. You may have expenses you'll need to be aware of and plan throughout the year. Remember, these plans are offered by private insurance carriers and generally have lower monthly premiums.
Great. Thank you, Cece, so much. So there's a lot of information when it comes to Medicare Advantage, and we'll talk a little bit more about Part C when we discuss the differences between Medicare Supplement and a Medicare Advantage. So now let's talk about Medicare Part D. So Corey, can you talk to us more about this?
You bet. Thankfully, understanding Medicare Part D is fairly straightforward. It's when we start looking at specific prescriptions is when you can get a little cross-eyed. Part D is solely focused on prescription drug coverage. However, it can be complex when you start looking at what plans cover for what prescriptions. This part helps you pay for prescription medications. And like Part C, it's provided by private insurance companies as well. Medicare Part D plans have premiums, co-pays, and out-of-pocket costs that may or may not include annual deductibles. Before enrolling in a Part D plan, it's important to understand how your prescriptions will be covered under that plan. Medicare.gov provides a comprehensive list of all the plans that are available in your area with formularies, which is a fancy way to say it's plans list of covered drugs. Not all plans cover the same medications. Part D is also optional. However, we highly recommend that you consider a Part D plan to ensure your entire health care needs are covered. It's just too big of a risk to not have a plan in place should your doctor prescribe medications for you to get you to feeling better. Even though you take no medications, we recommend you have a plan in place for changes in your health. Even though Part D is not required, if you do not sign up during your enrollment period and don't have credible coverage from another plan, you will be subject to a lifetime penalty for Part D. The biggest takeaway when thinking about Part D is investing the time to review your current prescriptions each year during the annual enrollment period, which is October 15 through December 7 each and every year. Plans and their coverage can change from year to year. We recommend conducting your prescription review by visiting Medicare.gov, or if you already have a Part D plan, visit your carrier's page to enter your prescriptions and compare plans to ensure whichever plan you select will meet your needs for the following year. Bottom line is, drug coverage is important. Take the time to do your due diligence and ensure that you're not hit with any surprise costs for your routine medications. Patrick?
Thank you, Corey. Prescription coverage is so important, with a lot of variables due to formulary changes year to year. However, the beauty is most individuals can visit their carrier website or Medicare.gov to figure out if their existing or available Part D plans align with next health care year. At USAA, we send out email reminders to our members with Part D about a month or two before the annual enrollment period, which again is in October, to remind them about going online, following the guided help, and to add or remove prescriptions. That way, when each of the carrier comes out with their updated plans, our members will be able to go back and easily see and compare costs from year to year. And by completing online, it helps to save our members time down the road. All right. I know we've covered a lot of information at this point, including what is Medicare Parts A, B, C, and D. And before we move on, let's pause here to run our second poll question of the day. So let me get it displayed for you on your screen. Okay, so you should be seeing it right about now. So we'd like to know what has inspired you to attend today's webinar. On this question, you can provide more than one response, and you have a number of options there for you to choose from. So we're really hoping to learn just a little bit more about where you are in your Medicare journey. We'll give you about 15 to 20 seconds or so to answer this question. And regardless of where you are in this process of Medicare, we're really glad that you're here with us today to learn more and hopefully walk away with a better understanding of some Medicare basics. So I'm going to go ahead and turn the poll questions off here in the next 30 seconds or so. But in the meantime, let's move on and talk about the last component of Medicare that's available to individuals, which is Medicare supplement plans, which is also known as Medigap plans. So, Cece, can you help us explain to the attendees today the Medicare supplement plans?
I sure can, Patrick. Thank you. Medicare supplement or Medigap plans coordinate benefits with original Medicare. These plans require a monthly premium and are designed to cover Medicare-approved expenses that you would typically pay if you only had original Medicare. Bottom line, if Medicare covers it, Medigap will pay your healthcare costs, resulting in less out-of-pocket costs for you. Medigap plans help to make your medical costs more predictable. Medicare supplements are offered by private insurance companies, and Medicare has Parts A, B, C, and D. The supplements also follow an alphabetical naming system, like Plan F, G, or N, and more. However, each plan has a set of minimum benefits that are standardized by federal law. So, for example, when you're comparing Plan G between different insurance companies, costs will usually be the only difference and is dependent on where you live and potentially your age. Medicare supplement plans work with Medicare's Parts A and B to help control your out-of-pocket costs. For example, most Medigap plans cover your Part A copay for your hospital stays, but Plans K and Plans L will only cover a portion of your Part B coinsurance. It's important to know which Medicare supplement plan will provide the coverage you need. Unlike some Medicare Advantage plans that include additional health and wellness benefits, Medicare supplement plans are generally don't contain these extra benefits, but they typically have less out-of-pocket medical costs than you would be paying in a Medicare Advantage plan. We'll take another look at comparing these options here in a few minutes. Back to you, Patrick.
Thank you, Cece. So, in short, a Medicare supplement or a Medigap is a private insurance plan that for a monthly premium covers copays and coinsurance to help with your out-of-pocket costs that you would have had with original Medicare alone. So you can't mention Medicare supplement without talking about Part D as well. And since Medigap plans won't cover your prescription medication, generally people who add a Medicare supplement plan, they also enroll in a Part D prescription drug plan to account for their healthcare needs. So now let's talk about eligibility and enrollment. It's one of the most important aspects of Medicare to understand, as there are penalty implications. There are questions surrounding individuals who continue to work past turning 65, and a whole other host of considerations. So, Corey, can you share information about enrolling in a Medicare with our attendees, please?
Yes, I'd be happy to take this one. And I'll start by reiterating that enrollment timing is crucial when it comes to Medicare. If you're already receiving Social Security benefits, you'll automatically be enrolled in Medicare Parts A and Part B. However, if you're not currently receiving Social Security, you'll become eligible for Medicare at age 65, and there's a 7-month window around that time period to sign up. This is known as the initial enrollment period. You may see it as IEP. The 7-month window includes 3 months before your birthday month, and 3 months after your birthday month. So let's take a look at a hypothetical to explain this enrollment window in case you're aging into Medicare. So let's say your 65th birthday is June 9th. For example, you'd be eligible for Medicare starting on March 1st, 3 months prior. And it would include the month of June, your birth month, and then 3 months after your birthday month, And that runs all the way through September 31st. The earliest effective date will be the first of your birthday month. We know there's a fair amount of people that plan to work past the age of 65. However, those individuals are covered by their employer's group plan for health insurance, or maybe you're on the primary of your employer's health plan and you're covering a spouse who will become eligible for Medicare. For either yourself and or your spouse, because you have a group health plan, it's considered credible coverage by CMS if you delay your Medicare Part B, and that'll have no penalty. Don't worry, if you delay Part B because of this, you can still enroll when you decide to retire or lose your coverage with your employer. If you miss your initial enrollment period, that 7-month window, around your birthday, there can be penalties. Medicare gives you a general enrollment period each year to enroll in Medicare Parts A and B, and that starts January 1st and runs through March 31st. There's also a point in time called the annual enrollment period. This enrollment period runs from October 15 through December 7 each and every year. If you're close to aging into Medicare, you probably received a lot of phone calls, emails, and I'm sure your mailbox has been filled up many a times as well, especially leading up to this annual enrollment period, reminding you that it's time to sign up for plans for the upcoming year. AEP is for all beneficiaries who currently have original Medicare, Part D, or a Medicare Advantage plan. This period allows you to switch between plans, add or drop plans, depending on what coverages you have or don't have. Another way to think about it is when you're working and your employer would have a window of time when you could make adjustments to your employee benefits, and AEP is very similar to this. Before AEP, it is always a great time to evaluate your healthcare needs and determine if what you have is really serving you well or if you need to make changes. A last enrollment period to be aware of, and we won't go into this much today, is known as a special enrollment period, and you may see it as an SEP. There are many reasons that could trigger an SEP. However, the most common is when you move to a new address or you lose your employer coverage. The bottom line about enrollments is know your initial enrollment period. That 7-month window is your opportunity to join Medicare. Again, there's the general enrollment period for those who missed that 7-month window for the initial enrollment period and may have to pay a penalty for missing that. And if you don't qualify for a special enrollment, of course. There are special enrollment periods, as we discussed, SEPs, that are special circumstances due to losing employer health coverage or moving to a new home. Basically, there's a lot of rules and timelines to coordinate. And that's why it's important to have a licensed sales agent in your corner to provide you advice while you're doing your research and to speak candidly about your options. Patrick?
Thank you so much, Corey, for sharing that. So enrollment timelines are so important. So let's take a quick pause here to take our final poll question of the day. So let me go ahead and get this displayed for all of you. So on this question, you can also provide multiple answers as well. And here's the question. Overall, what concerns you most about enrolling in Medicare? So you've got several options to choose from, and we'll give you about 15 seconds or so to answer this. Again, there are no wrong answers. Okay, so I'm going to start closing this final poll out, and we'll talk about the results. So let me go ahead and take a look at those results. Okay. By far, the biggest concern is needing help figuring out the right plan for your needs. So again, this is about in line with what we hear from our members who call in and speak with our licensed agents. Many just want help and to feel confident that they're looking at the plan that will take care of them when they need it. So thank you for all your responses. We appreciate all your participation today. So earlier we discussed Medicare Advantage and Medicare Supplement plans. And I'd like to talk about a question our licensed agents commonly receive from our members. They frequently ask, beyond original Medicare, what should they choose between a Medicare Advantage and a supplement or a Medigap plan? So, Cece, can you provide some clarity around this subject and how you'd go about answering this for an individual?
I sure can. It's a great question and something we do hear quite a bit from members calling in. It is a complex situation with a lot of variables. Everyone's health situation is different, and there are a lot of questions to consider when debating between a Medicare Advantage and a Medicare Supplement plan. First, understanding your current and future health needs is critical in determining the coverage you choose. Similar to other private health insurance plans, not all providers and facilities participate in Medicare Advantage plans. Physicians and hospitals can be tied to various healthcare networks. However, Medicare supplement plans or Medigap allow you to see any doctor, hospital, or medical facility that accepts Medicare. A consideration when thinking if a Medicare Advantage plan is right for you is knowing there are both HMO and PPO plans available, depending on where you live. An HMO, or Health Maintenance Organization, is a network of doctors, hospitals, and other providers who provide services for an agreed payment amount. An HMO network usually means you must visit doctors and hospitals within a specific network for non-emergency care to realize the full benefits of your plan or risk not being covered for your health care. When you're in an HMO plan, it may be required a referral to see specialists or to have certain tests or procedures done. A PPO is a preferred provider organization and provides a network of healthcare providers to use for your medical care. The greatest difference to an HMO plan is that with a PPO plan, you have a greater flexibility as it doesn't require a referral. If you receive care from an in-network provider, your cost share will be lower. If you see an out-of-network provider, your cost share will usually be higher. Out-of-network providers are under no obligation to treat a Medicare Advantage patient unless it's an emergency. You want to make sure your provider will accept payment from the Medicare Advantage plan. And also keep in mind, doctors can go in and out of network throughout the plan year. One reason Medicare Advantage plans are attractive to some folks is that you end up getting hospital, medical, and prescription drug coverage wrapped into one with most Medicare Advantage plans. Many Medicare Advantage plans have a lower monthly premium and may also have other health and wellness benefits. A Medicare supplement, on the other hand, will have a higher premium than a Medicare Advantage, but allows you to see any doctor that accepts Medicare. So you can A, pick your doctor, and B, you're not tied to a network. Coverages vary, but you can select a Medigap plan that limits your out-of-pocket. To give an example of how that might work, a Medicare Supplement Plan G is a comprehensive plan. If someone has a Plan G, it allows you to go to any provider that accepts Medicare. As long as Medicare approves that charge, your only out-of-pocket should be the Medicare Supplement monthly premium, your Part B premium, which usually comes out of your Social Security, and the Medicare Part B deductible, which this year in 2026 is $283. Medicare changes the Part B deductible every year, so that's something to keep in mind. Using the same Plan G example, if a member has several doctor's appointments, procedures, has a hip replacement, and so on, as long as it's all Medicare approved, the only out-of-pocket is the monthly premium for the Plan G and the Part B deductible. If you choose a Medicare supplement, you should consider purchasing additional coverages a la carte, including a standalone prescription drug plan, which is Part B. And if you need dental and vision, and that's important to you, those coverages can be purchased separately through private insurance companies like USAA. Coverages vary based on availability in your area. Some other considerations when thinking between Medicare Advantage and Medicare Supplement plans include whether you travel a lot, your geographic area, and your financial situation. Medicare Supplement plans are accepted anywhere Medicare is accepted. Because of that, these plans work well for those that like to vacation and travel across the United States. You can take comfort knowing your healthcare plan will travel with you. Compare that to a Medicare Advantage. where unless it's an emergency, your Medicare Advantage may be limited to your local network of healthcare facilities. One way to financially compare Medicare Advantage to Medicare Supplement is to consider when costs impact your budget. Medicare Advantage typically involves paying for approved care as you receive it, leading to bills you'll need to cover later. However, there will be a maximum out of pocket, which each Medicare Advantage plan will have. Compare that to a Medicare Supplement, where you'll pay a monthly premium for a Medigap plan, which offers valuable protection against healthcare expenses. Once Medicare approves the service, your Medigap plan steps in to cover the remaining costs, helping you keep your out-of-pocket expenses to a minimum, often down to zero. Now, it can be a bit overwhelming and confusing. There are many variations of Medicare supplement plans with nuances in each. As they say, the devil's in the details. Everyone's healthcare situation is different. It's always best to think what you value most in a healthcare plan. And that's why it's important to connect with a trusted licensed agent to help guide you through this process. Back to you, Patrick.
Thank you, Cece. That's a great breakdown. So as we can see, there are a lot of variables, and you might be feeling like your head is spinning just a little bit here and unsure of what's the right move for your health needs. Our USAA licensed insurance agents are available to help answer your questions and provide the advice you need to make an informed decision. And whether you're a current USAA member or not, our team is available to you, and we encourage you to give us a call should you need help making this important decision. You can reach our licensed insurance agents by calling 888-215-8702. You can do that Monday through Friday, 7:30 a.m. to 6 p.m. Central Time. Extended hours are available during peak times of the year. And you can find our latest hours by visiting usaa.com/Medicare, and we'd be happy to help out. So another one of our most asked questions we receive is, what Medicare options are available to an individual who has TRICARE for life, those who use the VA or CHAP VA for their health care needs? How does Medicare interact with these veteran-specific benefits? So let's dive into the topic just for a few minutes. So Corey, can you shed some light on veterans and Medicare, please?
Yes, absolutely. It's a great topic, especially here at USAA. So let's talk about this. Many veterans have healthcare options available to them as a benefit for their service in the military. Let's break down how TRICARE for Life, which you may see as TFL, Veterans Affairs, which most people know as VA, and Civilian Health and Medical Program of the Department of Veteran Affairs, which you never see, but CHAMP VA is definitely there. It's much shorter. And these programs may work for any one of these programs may work for you, really. Starting with TRICARE for Life, here are a few things to know. TRICARE for Life is available to TRICARE beneficiaries regardless of age or where you live, if you have Medicare Parts A and B. An individual is eligible for TRICARE for Life on the first day you have both Parts A and B. TRICARE for Life will still wrap around Medicare Parts A and B in coverage to absorb most, if not all, out-of-pocket expenses for services that aren't covered by Medicare. TRICARE for Life includes prescription drug coverage. TRICARE for Life does not include routine dental and routine vision benefits. Consider alternatives, such as a private insurance company for this aspect of your health if it's important to you. With benefits provided by TRICARE for Life, you don't need to sign up for a Medicare supplement or a prescription drug plan. Those interested in other health and wellness benefits potentially found in a Medicare Advantage plan may have to coordinate benefits and stay within a network. For members that use the VA, there are many variables to your circumstances depending on priority level, how far the nearest VA facility is to you, if you currently use civilian doctors, and simply if you love the VA. Most military members will have access to varying levels of VA care. The VA will not bill Medicare, so there's no coordination of benefits. The VA coverage is considered credible for prescription drug coverage, It is not, however, considered credible for medical coverage. That's the Part B. Sometimes you'll find that some prescriptions are not covered by the VA. Therefore, a separate prescription drug coverage may be appropriate. Some veterans that use the VA consider enrolling in a Medicare Advantage, a Medicare supplement, and/or prescription drug plan, which requires enrollment in Medicare Parts A and/or Part B. It's important to understand that if you utilize the VA for your health care, you can have other forms of coverage, including private insurance, Medicare, Medicaid, or TRICARE. The last situation includes individuals using CHAMP VA. CHAMP VA is similar to TRICARE for life. However, it's for covering the spouse and children of a veteran who died of a service-connected disability, or a veteran who died on active duty, or rated permanently and totally disabled to a service-connected disability. Those on CHAMP VA that are eligible for Medicare must enroll in Parts A and B to keep their CHAMP VA benefits. Both TRICARE and CHAMP VA do not include routine dental and vision benefits. If these services, again, are important to you, consider seeking private insurance coverage through USAA and its partners. You may want to keep these resources and these links handy for future reference if you fall under one of these healthcare plans. You can visit tricare.mil, M-I-L, and va.gov for more information. Patrick?
Thank you, Corey, for that breakdown. Medicare is a lot to take in, and then you add the layer of military benefits, and that requires another level of understanding. We appreciate you sharing that vital information with our audience. We know we have many in our audience that have questions around that topic. We talked about some resources our webinar attendees can visit to continue their research. And besides today's webinar, there are several places online that you can visit if you're finding yourself wanting more information. So we're going to go ahead and share a few resources that'll be good to keep handy should you need additional support. So consider visiting Medicare.gov, which is a great resource to help learn more about specifics on Medicare. You can also go to usaa.com/Medicare. And this is another great resource to learn more about Medicare. And you can always call to speak with one of our licensed insurance agents to get help with understanding the various parts of Medicare like we've discussed today. And you can reach them again at 888-215-8702. And for TTY devices, you can dial 711. A third resource is the State Health Assistance Program, also known as SHIP. At shiphelp.org, you'll be able to find links and guides to CMS and other information about Medicare. All of these resources are great tools to keep in your toolbox if you'd like to read more about Medicare. So we've covered a lot of information today, and thanks for sticking with us throughout today's webinar. We have a little time for some questions, so we'll get to those right now. Our team has been in the background helping to answer your questions you submitted. However, if we're unable to get your question or it's a bit more specific to your specific situation, we recommend that you call or speak with one of our licensed insurance agents at 888-215-8702. Okay, So let me sort through some of these questions. And I have one I think that is a really good question that will start us off. And we did talk about this a little bit earlier, but I think it's an important one enough to address again. So here's the question. What if I'm still working and have group health insurance coverage? So, Cece, can you take that one, please?
Yes, sir, I sure can. We talked briefly about this, but this situation comes up a lot. Let's face it, more and more people are working well into their golden years. If you are still working and covered by an employer health plan that is credible, at least as good as Medicare, you do not have to sign up for Medicare at age 65. You want to talk to an advisor about your unique situation, but usually folks will postpone Part B until they retire. You would want to sign up through the Social Security office for Part B approximately 2 to 3 months before you want it to go into effect. Most people go ahead and enroll into Part A because it usually has no monthly premium. Remember, you paid into it from your paycheck deductions for years. Check with your employer's HR or benefits team to understand what's best for you. If your employer plan is an HSA, high deductible, you could be subject to significant IRS penalties by signing up for Medicare Part A, even though it has no monthly premium. For reference, you can check out the IRS publication 969. Taxes are a tricky subject, so taking time to ask those questions if you're still working is very important. Patrick?
Thank you, Cece. So let's move on to the next question. So we have an attendee asking, does my wife and I need to be on the same Medicare supplement or Medicare Advantage or prescription drug plan? So Corey, I'm going to go ahead and toss this one over to you, please.
Yes, thank you. And the answer is no. We get this question quite often. First, Medicare plans are different from an employer group health insurance plan. When you're covered by your employer, you could extend healthcare coverage to your spouse and even dependents. When you enroll in Medicare, that doesn't apply. Each individual must choose and enroll in Original Medicare separately. And if you decide to add on a Medicare Advantage, prescription or Medicare supplement plan, or a prescription drug plan, that also must be completed by each individual in the relationship. And the reason is because everyone has separate needs. Medicare options fit accordingly to each and every one of us individually. For example, one person can be on a Medicare supplement and the other could be on a Medicare Advantage plan. Or you both can be on a Medicare supplement plan, but each individual would have their own plan. In that case, some states allow for discounts if multiple people within the same household choose a Medicare supplement plan. Each state and each carrier are different, but be sure to ask if there's an opportunity to benefit from this discount. Did that answer the question, Patrick?
Absolutely. Yes, that was great. Thank you, Corey. So we have time for one final question before we wrap things up today. So I heard that I needed to complete a medical exam when I enroll in a Medicare Advantage or a Medigap plan. So Cece, can you help our friends with this question, please?
I sure can. Okay, friends. So the answer is it depends. Medicare Advantage plans do not require a medical exam. However, Medigap plans can require medical underwriting, depending on the time frame in which you enroll. As we discussed, if you enrolled in Original Medicare, that's Parts A and B, you can enroll in a Medigap plan within 6 months of your Part B effective date without medical underwriting. You may also be eligible for guaranteed approval if you have lost other creditable coverage and not had a break in that coverage in excess of 63 days. Now, if you decide to switch from a Medicare Advantage plan to a Medicare supplement plan, that will require you to complete medical underwriting. This means your past medical history and current health status are reviewed through an underwriting process, which can differ from state to state. So it's best to check with a licensed insurance sales agent to determine the option that's available to you. How's that, Patrick?
That's awesome. Thank you, Cece. Appreciate that. Well, that's all the time we have for our questions today. So thank you to everyone who has submitted a question, and hopefully our team was able to respond to your question and provide some guidance for you. As I've mentioned earlier, if we didn't get to your question, we recommend giving us a call at 888-215-8702 to speak with a licensed insurance agent that can help you with your specific situation. And again, you can always visit Medicare.gov or USA.com/Medicare or shiphelp.org as additional resources if you have additional questions. So as we set to wrap up today's webinar, I want to thank all of you for joining us today to explore the basics of Medicare Parts A, B, C, and D. A special thanks goes to our Senior Health Solutions Specialist, Cece and Corey. Your expertise and time is greatly appreciated. Thank you, guys. So we hope you've learned a little bit more about Medicare and have a better understanding of why this is an important part of your healthcare journey. Your health and well-being matters, and understanding your options is a powerful step. So we applaud all of you for wanting to act by wanting to learn more. I hope all of you have a wonderful day. Take care, everyone.